Hello, as you all may know, this video is going to be a little bit long because I am planning to go over everything in this list. This is probably, and I hope this is the final list that he will be requiring from all of you for the oral exam. It's about 26 points, and I will just dive into all of those points quickly so that it just gives you a quick review of those things, although I've had videos of every single one originally. I will try to make it as quick as possible because some points need so many more minutes, but let's just dive into it. So for the vertebral column, number one. For number one, you would need to know everything, and it'll be enough for you to understand everything within this page. So first off, the function of it, provide the central axis to the body and supports the weight, protects the spinal cord, because as you all may know that the spinal cord passes within the structure of it through the vertebral foramen. The vertebral canal, okay? So the structure consists of vertebrae, of course, individual ones that are stacked upon each other, except for the sacrum and the coccyx. They don't have individual vertebrae and they are joined together, unlike the rest of the vertebra. And of course, as we all may know by now, they have intervertebral discs at around the region of the body, okay? That's for its structure. Regions, we have to describe that it's a cervical, thoracic, lumbar, and sacrum. For the cervical, there are 7 vertebrae. For the thoracic, there's 12 vertebrae. For the lumbar, there's 5. For the sacral, 5, but they're fused. And for the coccygeal, there's 4. The length, we don't really need this very much, but then we have to just dive into the curves. As you all may know by now, there are a couple of curves that are found within the structure of the vertebrae. So as you all see that the vertebra is not completely straight, and here highlighted in green, it's curved, and we have primary curves and secondary curves. The primary curves, they are concave forward. They are in the thoracic region. Right here, the thoracic region is just around the region of the ribs, the thoracic cage, and we have the sacral region just here close to the pelvic gird. And then we have the secondary curves. They are convex forward and present in the cervical region, just on the top, and the lumbar region. And if you see that they are these curves, you see they're convex forward, here concave forward. If you can see it right here, it's concave forward, okay? And for the sacrum, it's also concave forward, okay? And why is it called primary and secondary? Primary, because it's present since the start of the growth. Primary, if you can see here in the baby structure, it is concave forward, okay? This means that it's a C-shaped, and if we line the skull just as how the baby is lined up here with the nose to the left, we can see that the curve is this way. So anything that is like it is primary. So in this region, it's the thoracic and the sacrum. You can see a C shape that matches this part within the baby. And that's how the baby is. So it's primary. Anything that becomes against it and turns to be this way, on the opposite hand, this way is called secondary because it evolves later in growth. So this is the cervical region and the lumbar region. Okay, so if you mention those things about the characteristics, general characteristics of the vertebra, and mention all of the things, including the regions, the functions, the structure, the intervertebral discs, the how many vertebrae within each part of the vertebra, the curves of it, it holds the spinal cord and stuff like that, I think you'll be fine with the vertebral column. General characteristics. Maybe he'll want you to then dive into the ligaments that hold it and stuff like that. Then that could be a case, but I think there is a separate point for that. So might not be important, but if he does, then you can just dive into all of the ligaments that form around the structure of the vertebral column, including the anterior longitudinal ligament, posterior longitudinal ligament, ligamentum flavum, the interspinous, the supraspinous, and some other ones such as the intervertebral disc, which also joins the zygoepiphyseal joint, is another one. And then you can also dive into maybe if he wants more things to talk about the axis and atlas, and then you can describe that the structure of them and how the dents right here inserts. Just give me a second. The dents of the axis inserts into the structure of the atlas, and then maybe you can dive into the ligaments and stuff like that around this region. You can see that the axis is the main form of contact with the skull and stuff like that. Like, you can say so many things about it. But just if he says vertebral column, general characteristics here, point number 1, all of the features that I mentioned in this page within 17th of the book of the notes is enough. And you can add from your knowledge if he wants more, okay? Next, we're gonna move on to the general vertebral characteristics. And now what I'm gonna do is I will guide you through this, but I will take one vertebral body and discuss upon it. So for this one, I'll probably wanna take I don't know, maybe a lumbar, because the structures within it are the largest, and probably it's the most clearest out of all. I'll just isolate this one, and here we can see a vertebral body. And for point number 2, this is what you'll be describing. Everything you see onto this body right here, not the vertebral column as a whole, but the general characteristics of the vertebra, like one vertebra, okay? Vertebral column vs vertebral characteristics. So now we're going to dive into the vertebral characteristics, and I will just want to take the help of here so that I can just guide you quickly over it. Vertebral column and vertebra 17. Yes, it's on the next page, I think. 17 right here, general features of the vertebra. Okay, so we have created a video of this separately. I don't want to take so long in this one, but I will just dive into it very quickly for you. I'll just get this right here. Okay, so first off, you'd want to have an image of this structure within your head before you start speaking, because as you all may know, anatomy is all about the image within your brain, and that's how accurate you'll be when describing things for Swirsky. First off, we have 3 sections within the vertebral structure. Now, the 3 sections are separated into the body, which is this part right here, this lump. Is called the body. Then we have the vertebral arch. Vertebral arch is found right here. Everything within this structure is called the vertebral arch, and you can see it also from here. The arch right here that extends from one region of the body to the next, and finally the vertebral foramina, which is in the center between the body and the vertebral arch. Okay, that's the general characteristics of the vertebra. Now we're going to dive into its specifics. The body. Okay, the body. Its size increases from above downwards as it transmits the body weight. So as you see that I've chosen the lumbar, and the lumbar has the greatest body size, and it's found down the vertebral column. So the vertebral column starts with small vertebral bodies, and it becomes larger in size down. It consists of spongy bone covered by shell of compact bone. Not very important, but like you can mention it, it'll be nice. It has surfaces for intervertebral discs up and down. As you all may know, intervertebral disc will be found here, in this region, and in this region. And you can see it on the structure very quickly. I'll just show you. If I put connective tissue, you can see that the vertebral discs are found boom and boom, okay? Then I'm just going to isolate it again. We are then going to go into discussing the vertebral arch. Now, the vertebral arch has a lot of structures within its course. So it starts from one region of the body and extends to the next. Now, if we're going to look at the lumbar actual orientation, it'll be situated like this within the vertebral column, where the spinal process is pointing downwards. Now, first off, we have the pedicle. The pedicle, one on each side. Okay. It is the part extending from the body to the transverse process. So from the body, that's the body, to the transverse process, that's the transverse process. And the pedicle is this part, and pedicle. So we have two on each side. Between two successive pedicles, there's an intervertebral foramen, which exits to the spinal nerve. In this case, you would see this intervertebral foramina through the region where there. So they're talking about the intervertebral foramina here. You see there, this structure right here, I'll just zoom in for you. This part right here is called the intervertebral foramina, and between each pedicle, so we have a pedicle here, between it is the intervertebral foramen that allows for the exit of the spinal root on each side, for between each two consecutive pedicles on each side of the spinal cord of the vertebra. Okay, that's for the pedicles. Now let's isolate it again. Okay, when we isolate this again, we can see the laminas. The laminas, one on each side again. It is a flat plate between the transverse process and the spine. You see, between this transverse process, that's the spine, and what's between it is the lamina. Okay, so lamina, pedicle. All right. Next, we're going to discuss the transverse process. Okay, one on each side. It projects laterally at the junction of the pedicle. Okay, here. It serves for the attachment of muscles, ligaments, and acts as lever, rotatory, and side movements of the vertebral column. It also acts as a fulcrum for the rib. So, of course, remember that the transverse process articulates with the rib near its head, with the articular tubercle of the rib near the neck. So that's the transverse process we discussed. Now the pedicles, the laminas, the transverse processes, the body. Now we're going to move forward. We have the spine. The spine is this part right here. It's the most posterior part of the lumbar vertebra. It projects backwards at the meeting of the two lamina. It is the only part of the vertebra which could be felt subcutaneously. What this means is that if you put your fingers to try and touch where your spinal cord is, and what you touch is actually protruding parts or the protuberances of the spine. It serves for the attachments of ligaments and muscles. Okay, so again, it's like the transfer process, allows for the attachments of ligaments and muscles. And then you have two superior articular processes, as you can see, 1, 2, and then two inferior, 1, 2. Okay. Now for each different vertebral column characteristics, different regions have different orientations of those articular processes, and you are required to know how those articular processes, superior and inferior, are aligned. For in this case, for the lumbar, you can see that the articular processes of the lumbar region, they are pointing posteriorly, medially. Okay, posteromedially. And for the inferior ones, they're pointed anterolaterally. So you can see that they're pointing anteriorly towards the body, okay, and laterally. But for the superior ones, they're pointing backward. They point posteriorly and medially, okay, towards the spine. So that's for the lumbar. Now, if you differentiate this part, the articular surfaces, with the other ones, now let's go and look at the other ones. For example, let's take a lumbar vertebra from the thoracic region. I hope I'm able to. It's very tricky. Oh, come on. Here. Come on. There. So isolate this. Now we're going to look at the articular surfaces of the transverse ones. So this is just pointing posteriorly, okay, postero-superiorly, and you see my words, postero-superiorly. So they point posterior and a kind of superior, and here they're pointing anteriorly for the transverse process. Okay, you can see that it's also pointing a little bit medially, but just know that they're a little bit different than the lumbar. Now, if we go isolate, and I think in Subota they're very specific to those directions, and I think you're able to check exactly what those directions and words are pointing at, and that's how accurate you should be for this one. Finally, for the articular processes of the cervical, and you have to also be able to describe how they're pointing for the cervical. For the cervical, they're pointing postero-superiorly, and for the inferior ones, they're pointing antero-inferiorly. Okay, so antero-inferiorly and postero-superiorly. Okay, for the transverse, I think you're just able to just say for the superior they're pointing posteriorly, and for the inferior they're pointing anteriorly. That's how deep you should be when it comes to their directions. Okay. Then we're going to talk about the vertebral foramen, spinal cord, and it's covering meninges passing through the vertebral foramen. I hope I can just show you what this vertebral foramen is like. I don't know if I'm able to just take a look here. No, but let me see. Can I do this? If I hide the skull, can I hide the skull? No. Okay. So let's hide. Okay, there. So you see here, this part right here, you can see that there's a, if we remove it, can I just hide it? Yes. So if you see there's like a, if you enter the space, it's a canal. And if you go down just this whole vertebral column, you can see that the spinal cord takes on the whole structure within the vertebra. And that is why the spinal cord is present in the vertebral foramen. This part right here is called the vertebral foramen, and it's present in every vertebra as you isolate and look at it. Arteries and veins, of course, are present there, roots and ganglions, and also loose fatty tissue. Okay, that's for the third part of the vertebral characteristics. And because we are discussing vertebral characteristics, as I differentiated how the articular processes of the three regions of the vertebra, cervical, lumbar, and thoracic, differ, you have to differentiate and be able to differentiate between the three vertebrae: the cervical, the lumbar, and the thoracic. And just quickly, so that I don't take most of this time, there's always tables that summarize these differences, and you have to know it for this point. Cervical, thoracic, lumbar, vertebrae. Oh, fuck. There. So images. There. So, for example, such table. Can't even zoom in. Let me just go in there. So here, I'll just go into it. I hope I can see it. There. So for example, this table right here, you see long split. Let's see, the body is all curved, medium heart-shaped, oval-shaped, such things. Like you're responsible to know body, vertebral foramina, spinous process, transverse process functions, you have to be able to differentiate the three structures of these. An accurate resource, I think this is summarized here. Of course, you have to know the atlas and the axes characteristics as well for this point. But what I'm trying to tell you is here, you have to be able to list the features of the cervical region. Right here, you have the important ones within the cervical region. But look, typical cervical vertebra, body, transverse process, spine, superior articular process, and the inferior articular process, and the vertebral foramina. You see, they're specifying them here, plus atlas and axis. Now then they go dive into the thoracic vertebrae. It's present on a different page. And also for the lumbar, you have the body, the vertebral foramina, transverse process, superior facets, inferior articular facets, the spine. And you have to make sure that you're very good with it. And I think Siriski have already pointed this out. And I've shown you this in my vertebral features video. You can check it out. Okay, so this is the second point, and we are done with it. We're going to move on to the ribs and the sternum. So ribs, very quickly, it's on 22. Okay, so where are the ribs? Yeah, that's the sternum. We need the ribs. Yes, there. Okay, so for the ribs, we're going to I'm going to get the axial skeleton, isolate there. So the ribs, they're obviously found within the thoracic region of the vertebral column. Why thoracic is because here, this part right here is the seventh cervical vertebrae. So C7. At T1 comes after it. You see T1 starts where the ribs are, where the ribs start, okay? And it goes until the 12th rib, which is attached to T12, okay? From T1 to T12, so that's where the ribs are mainly found, okay? So the ribs, what do I start by saying? Of course, it's so easy to look at them and admire them, but also when it comes to explaining those details that Siriski wants can be very difficult, but in the beginning, but when you study, it's not very hard. Okay, so first you'd want to say there are 12 pairs of ribs. Okay, all of them articulate posteriorly with the bodies of the thoracic vertebra, and they attach anteriorly, if you can see, anteriorly to the sternum. Okay, and they're, because of how they're attached to the sternum, they're classified into three main groups. Okay, the true ribs, false ribs, and floating ribs. The true ribs are the upper 7 ribs whose costal cartilage join the sternum directly. Okay, so you have to know that the ribs themselves, and you see there's a space right here within this stimulation. Why? Is because the ribs themselves do not join bone to bone, but the costal cartilage, see, costal cartilage of these ribs connect them to the sternum. So the sternum is connected to the costal ridge of the ribs, which are connected to the ribs themselves. So I will show you, for example, we're just going to do this. Now there are spaces, right? I go connective tissue, boom. And you see that this right here is costal cartilage. And these true ribs, they are connected, right, to this sternum by their own costal cartilage directly. So if we look, number 1, 2, 3, 4, 5, 6, and 7. Now, all of those, you see, with their own costal cartilage to the sternum, 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 until you reach number 7. Now we have another category, false ribs. They're 8th, 9th, and 10th. So we have 7, right? Until here, you have 8th, 9th, and 10th. And these do not connect by their own costal cartilage to the sternum. Instead, they're connected through their costal cartilage to rib number 7. Then rib number 7 connects them to the sternum. And that's why they're called false ribs, whose costal cartilage join each other and join the 7th costal cartilage, forming the costal margin, whatever. But you get the idea. Floating ribs, the 11th and the 12th, who end freely in the abdominal muscles. Here, look, they're floating. They're not attached at all. Wait. They're not attached at all to the sternum or any of the costal cartilage of the other ribs, and they don't have costal cartilage. So 11 and 12. See, they're floating, nothing. So these are the 3 categories that you have to classify the ribs according to the relationship with the sternum. Now, the second type that you can classify the ribs into, classification according to their relations to the vertebral column. And these, now we're going to look at the other end of the ribs. Now we're not looking at this end, but this end. And they are separated into typical and non-typical. The typical ribs are from 3 to 9, and why they classified into typical is because the posterior head of each of them articulates with 2 thoracic vertebra and the intervertebral disc in between. Let me show you what this means. Here, see, we're just going to look at the rib. I don't know if this simulation is very accurate to show you this part. How am I going to show you this? Here we go. So you see this part right here? Head of rib, there. So the head of the rib, you can see, it has an articular surface. Okay, let me just take off the connective tissue, there. So it has, the head of a rib has an articular surface, has 2 articular surfaces. One that articulates with the above vertebra, and second that articulates with the below vertebra, and also articulates with the intervertebral disc below. And these ribs are called typical ribs. Now, a non-typical rib, such as 1, 2, 10, 11, and 12, the head of each each non-typical rib articulates with the vertebra of the same number, okay, with the exception of the second rib, which articulates with the with 2 vertebrae. Okay, so just focus on 1, 10, 11, and 12. 1, 10, 11, and 12, they don't do this arrangement. They do not articulate with the top, bottom, and the vertebra in the intervertebral disc between, but instead, what they do is just articulate with that one thoracic vertebra itself. So, for example, number 1, I'm going to show you. Number 1, you see why? Number 2, look at number 2 and number 1. So number 1 articulates just with T1. Number 2 articulates with T1 and T2, and plus the articular disc. That's why it's called a non-typical rib for these ones. Okay, so they articulate with one vertebra, like the vertebra that is the same number as the rib, but the three typical ribs, they articulate with the two vertebrae that are close to each other with the articular disc in between, and that's how we classify them when it comes to their relationship with the vertebral column. Okay. general features about all ribs and costal cartilage. Let's see. Okay, I don't need to discuss this. The general features right here, typical ribs, they have the anterior end, which is in relation, of course, with the sternum, articulates with the costal cartilage right here. Okay, all of them, they articulate with costal cartilage except for 11 and 12. The shaft is divided into is divided by the angle. Of course, there's the angle of the rib into posterior 1/3, anterior 3/4. Okay, and of course it has two borders and two surfaces, up and bottom. Okay, this is for the shaft. The posterior end, on the other hand, as we said, look, has two articular facets separated by a crest. Okay, which articulates with the intervertebral disc. Okay, the upper facet, lower facet, the crest. The upper facet articulates with the lower demifacet of the body of the vertebra. The demifacet is a fancy name just to tell you, demifacet just to refer for the articulation surface of the vertebra. So upper one right here articulates with the lower demifacet of T4. The lower facet of the head of the rib articulates with the upper demifacet of T5. The crest articulates with the intervertebral disc. There, we already mentioned this. And we have the neck, flattened part between the head and the rib. It is connected to the transverse process of the vertebra of the same number and the vertebra above by the inferior and superior costal transverse ligament. And you can look into this deeper right here. You see, the neck is connected to the trans process of T5, but it also connected with the superior inferior costal transverse ligaments to the T4. Okay, that's the main connection. And the tubercle is formed of two parts. The medial, this is not needed. Just know there's a tubercle, but make sure you know what it articulates with. It articulates with the trans process of the vertebra of the same number, and gives attachment to the lateral costal transverse ligament, connecting it to the transverse process of the vertebra of the same number. You have to really pay attention to this part and watch. My advice is to look at so many pictures and read about it until you get your head wrapped around it. It took me a lot of time to actually really understand this part, but once you get it, it's easy to do it. But I will not discuss it right now for the time that I have. Non-typical ribs, within the notes, if you have these notes, it discusses why rib 1 is a non-typical rib. And for every rib, you have to just know a reason why it's not a typical rib. It's not a non-typical rib. And these may be always revolved around the head having only one articular surface and it articulating with one vertebra. Okay, but you can just go read ahead and add more notes if you'd like. But what I said is actually enough. Next, this is the ribs. Now we're going to discuss the sternum. So this was all for the ribs. Now we're going to discuss the sternum. The sternum made up of manubrium, body, and xiphoid process. The xiphoid process is at the level of T9. The manubrium and the body are joined together by the manubriosternal joint, which forms the sternal angle, which is found at the T4 level. And the body and the xiphoid process are joined together by the xipho-sternal joint. And you'd have to really know what type of joints these are. And I think, as far as I remember, the sternal angle is the manubriosternal joint. I think it's a secondary cartilaginous joint, and the xipho-sternal joint is a primary cartilaginous joint. I think, I'm not sure. Yeah, but just make sure. Let me just do it right now. Xipho-sternal joint type. Yeah, synchondrosis. Wait. Is a primary cartilaginous Yes, exactly. So Xiphoid process is a primary cartilaginous joint. The other one is a secondary cartilaginous joint. And okay, and furthermore, talking about the sternum, I'm just going to isolate it right now for you. It has articular surfaces within a structure on the sides of it, and I'm going to start by saying what they are. So here on the top, you have a spot for the attachment of the clavicle. So that's the clavicular notch. Let me just go there, yeah, and just click on it. I hope it just works right now. Yep, clavicular notch. Okay, this is called the jugular notch. Okay, let me just do it here. Ah, come on. Yeah, jugular notch, clavicular notch. That's the joint for first rib, the costal notch number 1, where first rib joins. Then they have that demifacets, costal notch number 2, or for rib number 2. But here you have demifacets, superior and inferior, where the sternal end of the rib number 2 joins. It's just at the sternal angle. That's the sternal angle. That's the point where the sternal angle is present. Then you have 2, you have 3, 4, 5, 6, and 7. Okay, I don't think this is accurate, but 7 is supposed to be like 2. Okay, and it's at the xiphoid joint. And remember, 7 is where the last costal cartilage of rib number 7 attaches. And remember, costal cartilage of number 7 allows for the attachment of costal cartilage number 8, 9, and 10. As we remember, in this region right here. See, costal cartilage number 7 right here allows for the attachment of 8, 9, and 10 costal cartilages. Sternum done. Next point. Skeleton of the free upper limb. Okay, skeleton of the free upper limb. I'm gonna start upper limb. Isolate. No, I want not the connective tissue, but I need skeleton, just the upper limb. Upper limb. There, isolate. There, so that's the skeleton of the upper limb. You have to be able to describe this very thoroughly and quickly. I'll just go and dive into it right now. First, we have the, I don't know if he'd want you to just talk about the scapula, the pectoral girdle, which is the scapula and the clavicle in this region. But I think mainly when he says skeleton of the upper limb, wait, let's see. Shoulder gird. Yes. So just talk about the pectoral gird, which is shoulder gird. So scapula and the clavicle. As you all may know, scapula and the clavicle. I don't know if we should dive into huge details on them, but just mention what the scapula is made up of. Mainly, it's made up of the here the clavicular coracoid process. Let me see, my brain just zoomed out right now. Yeah, of course. So we have the acromial process, okay, and I think the coracoid process. Fuck, my brain just zoomed out. Excuse me a second. Processes of scapula. Yes, the coracoid process. So you have coracoid process, which is this one right here. Okay, coracoid process, acromial process. Acromial process joins with the clavicle by the clavicular joint. We have the costal surface, posterior surface. The posterior surface of the scapula is separated into the supraspinous and the infraspinous fossas by the spine of the scapula. The spine of the scapula extends to form the acromial process. And then we have on the three borders of the scapula. We have the lateral border, the medial border, and the superior border. The superior border has superior clavicular notch, I think. And what those fossas on the posterior end allow for, they allow for the attachment of the infraspinous and supraspinous muscles, and for the costal surface, there's subscapular fossa is here, so it allows for the attachment of the subscapular muscle. That's for the scapula. And on the superior end of the lateral border, it contains the glenoid cavity. The glenoid cavity is for the articulation of the humeral head with the glenoid cavity for the formation of the shoulder joint, and the articular and this joint resembles a ball and socket joint. The clavicle, on the other hand, joins together with the sternum on the clavicular notch of the manubrium of the sternum. And of course, we discussed that it is concave, convex front on the medial two-third of the clavicle, and it is convex front on the lateral surface of the lateral one-third of the clavicle. And remember that this clavicle allows for a long range of motion of the upper limb in relation with the sternum, because of this joint right here, the clavicular sternal joint, which resembles a ball and socket joint because of its huge range of motion. Secondly, we're going to discuss the humerus. The humerus, we're going to just isolate it right here. The humerus, it is made up of the proximal end, the head, the lateral, the lesser and greater tubercles. The lesser tubercle is found more medially, and the greater tubercle is found more laterally. Then we're going to talk about the shaft of the humerus. Contains three surfaces, three borders, and if we cut it, we find that it's a triangular shape because of three surfaces and three borders. What else? We have the supracondylar ridges on the posterior aspect, that when it reaches below to the distal end, it splits into the to reach to the medial and lateral epicondyles of the humerus. And on the distal part of the humerus, we have the medial condyle and lateral condyle, and the surface, the distal surface of the humerus articulates and forms a part of the elbow joint as it articulates with the ulna and the radius, and the part of the humerus that articulates with the ulna on its trochlear notch is the trochlea, and superior to the trochlea we have the conoid fossa, and on the lateral, and this is on the medial end. On the lateral end right here we have the capitulum. The capitulum is used to articulate with the radial articular surface on the superior end of it, and above the capitulum, anteriorly, we have the radial fossa, and on the posterior end, we can see a depression right here called the olecranon fossa for the articulation with the olecranon process of the radius when the elbow is flexed. Now we're going to dive into the radius and the ulna. My brain is going nuts. 1 second. Okay, the ulna. So the ulna is made up of proximally, it is made up of the olecranon process and the conoid process. Yes, coronoid process. Okay, coronoid process and the olecranon process, and we have the trochlear notch, just this notch right here, the surface articulates with the trochlea, of the humerus. Then we have the radial notch right here for the articulation with the radial head, as we see right here, as the radius head articulates with the radial notch of the ulna. Now we're gonna dive also into its shaft. Its shaft is made up of 3 surfaces, 3 borders, and more distally, if we rotate it like that, wait, let's see how this is. Yes, it has a styloid process right here, and this part of the ulna will have an articular disc articulating with the carpal tunnel triquetrum, a carpal tunnel bone triquetrum, to form part of the wrist bone, and I will show you guys this in a bit. The radius is made up of proximally an articular surface. Here it is a concavity that's found on the superior end that articulates with the capitulum, and this head will articulate with the radial fossa when the elbow is flexed, and the capitulum and the radial fossa is found above the capitulum. Then we have, I think, the neck, and then there's a radial tubercle for the attachment of, I think, one of the muscles of the arm. I don't know, maybe the biceps or the brachialis. Not sure, but later we'll discuss this. Then we have 3 surfaces, 3 borders, and of course we have the distal end, a styled process for the radius as well. And here we know that the radius articulates with the scaphoid and the lunate without an articular disc, and it's the main contributor for the wrist joint. Now we're going to go into discussing the carpal bones. The carpal bones, you see, this carpal bone right here is called the scaphoid. That's the lunate, that's the triquetrum, that's the pisiform, that's the hamate, that's the capitate, that's the trapezoid, and that's the trapezium. And these are the carpal bones of the hand, and they form the roof of the carpal tunnel. I think that's part of your practical if you'd want to get a bonus on your oral. Let me know if you want me to create a video on the practical points, but I just felt it's not important because it's just bonus. But we'll be happy to help. Okay, next we're going to discuss, and that's the carpal bones. Now we're going to discuss these bones. They're the metacarpal bones. They're 1, 2, 3, 4, and 5. And then we have the phalanges. We have proximal and distal. And then we have for the 1, 2, 3, 4 fingers, we have not just proximal and distal, we have proximal, middle, and distal, proximal, middle, and distal, proximal, middle, and distal, proximal, middle, and distal. That's for the upper limb, and that's put on. All right. Next, we're going to discuss skeleton of the shoulder gird, which I did already. Thank God. Legend. And we discussed the bones of the hand. Amazing. Okay, so when he asks you skeleton of the free upper limb, mention the bones first, and then mention their characteristics, and then mention maybe the joints involved in them. Done. Skeleton of the shoulder gird, mention the scapula, the clavicle, and how they articulate with the sternum and with each other, and with the shoulder joint and stuff like that. For the bones of the hand in general, just go into diving into what they are, how they're situated, joined to what, and mention all of them. I think you'll be fine. That's just generally. The skeleton of the pelvic gird. I thought this would be easy to just put everything in one video, but this is a lot. So I don't know if I'll just stop when I'm tired, and then maybe start another video where I stop. Classification of the skeleton bones of the free lower limb. There, number 7. Free lower limb, quickly. The free lower limb, you're going to start by femur. You don't need to start by the pelvic gird. Femur, mentioned all the details, mentioned distally, you have to mention that it has a head, has a neck, has a greater tubercle, has a trochanters, lesser and greater trochanters, ball and socket joint. You have to mention its shaft. Then you have to mention that it has condyles. It has a surface that articulates only with the patella. Then it forms mainly part of the knee joint. Then you go dive into the tibia, which is the main contributor to the knee joint. The fibula does not take part of it. It's just attached to the lateral superior most proximal part of the tibia. Then you have to talk about the tibia, for example, the shaft of it, and then you just talk about how the tibia has a medial malleolar process, it's from right here on the medial end and articulates with the talus together with the fibula, with the talus to form the ankle joint. And then you have to mention all the bones: talus, calcaneus, navicular, cuneiform, the three cuboidals, medial, middle, intermediate, lateral. Then you have to talk about the metatarsals. Just give me a second. Metatarsals, and then you got to talk about the phalanges. This one does not have a middle, just like the metacarpal, the hand phalanx, no middle. Then there's middle for the rest. That's for the lower limb. Joints of the where is it? Femoral limb, bones of the foot done. Skeleton of the pelvic gird. Skeleton of the pelvic gird. We've talked about it a lot. Ischium, pubis, ilium. Dive into the ischium, dive into the ilium, talk about the crest, the alas, mainly the crest, the alas, how the pelvic gird is made up of two hip bones, and between them is from the sacrum. The two hip bones are joined to the sacrum by the sacroiliac joints on either ends. Then you're going to talk about the anterior border of the ilium, ACs, so anterior superior iliac spine, and then anterior inferior iliac spine. Then we have the acetabular notch. We're going to then talk about the posterior side of it, where we have the posterior superior iliac spine, posterior inferior iliac spine. Then we have the crater sciatic notch, and then we have we'll just leave that to talk about the ischium. Then we're going to talk about the pubis. The pubis is formed of the body, the superior rami and the inferior rami. The body, superior rami, inferior rami, and it forms the pubic symphysis right here. The inferior rami of the superior pubis joined with the ischial ramus to form the ischiopubic ramus that holds the obturator foramen. The ischium, so much to talk about. The ischium is made up of very important parts such as the ischial tuberosity, ischial spine, and they form regions where for the attachment of the sacrotuberous ligaments and the sacrospinal ligaments for the formation of the greater sciatic notch and the lesser sciatic notch. Then we're going to talk about the acetabulum and how the ilium forms the superior part of it, how the pubis forms the anterior inferior part of it, and how the ischium forms the posterior inferior part of it, and how there is part of the acetabulum, which is the acetabular notch that is found inferiorly and is covered by the transverse ligament there. Then we're going to talk about all of the ligaments probably present in this region, and I've summarized it in my pelvic gird video on my YouTube channel. Okay, pelvic gird structure done. Classification of joint, easy. We have fibrous, we have cartilaginous, and we have the synovial. The fibrous, we have gumphoses. I forgot, 1 second. We have gumphoses, yeah, habibi. 1 second. Yalla, I'm coming. Classification of joints, number 10. Where is it? 10, 10, 10, 10, 10, 10, 10, 10, 10, 10. There. Joints, we have fibrous, we have the sutural joints found in the skull between every single bone within the skull except for the temporal mandibular joint. We have the syndesmosis, such as their interosseous ligaments found between the tibia and fibula or found between the ulna and the radius along their structure, and the gum fossils found in the teeth. We have the cartilaginous joint, we have the primary cartilaginous joint, we have the secondary cartilaginous joint. Read more about them, already said them. So I know we have 6, and they're the plane joints, by pivot joint, hinge joint, ellipsoid and condylar, they're 1, and saddle and ball and socket. These are the classification of joints. You just have to know them. Joints of the vertebral column and thorax. We have discussed this so much, but I don't want to go over them, all of them right now, but quickly, the vertebral column, as top of my mind, we have the intervertebral disc, the zygosphegeal joints, the anterior longitudinal, the posterior longitudinal, the ligamentum flavum, the interspinous, the interspinous, the supraspinous, infraspinous, something like that. These are all the joints of the vertebral column. Yes, so if you're asking, yes, ligaments are joints according to Swirsky. The thorax joints, and just mention them right quickly right here. Have to get the connective tissue on there. So we have to be talking about okay, let me just get them here. Where did I put it? Yeah, it's here, okay. I'll just get it out for you. Yeah, this is a very good summary of all of them. So you have the joints of the vertebral column, all of them right here. As I said, we have the intervertebral discs. We have the anterior longitudinal ligament. We have the posterior longitudinal ligament, the zygosphegeal joint, ligamentum flavum, the interspinous, the supraspinous, the nuchal ligament. We have then we can talk about the atlanto-occipital joints and the ligaments found within here, atlanto-axial joints, and found ligaments found in here, such as the transverse ligaments of atlas, longitudinal ligaments, the other ligaments, the tectorial membrane, then the joints of the thorax, intervertebral, costovertebral joints, costotransverse, sternocostal, sternoclavicular, costochondral, interchondral, manubriosternal, exhyphosternal. If you want me to just show you where these are, intervertebral, adjacent vertebral body. Yes, so intervertebral, I think they're just talking about the joints between the vertebral bodies. Then we have the costovertebral joints, head of each rib with superior demifacet. Yes, so the costovertebral joints is where the ribs join the vertebra, and they're telling you head of each rib with the superior demifacet or costal facet of each body, vertebral and inferior demifacets. So they're just talking about the joints that we have discussed when it comes to the typical ribs that are found here. Superior demifacets, inferior demifacets, the one between them, the intervertebral discs and the head of the rib, that's called the costotransverse, the costovertebral, because costovertebral, the rib with the vertebral bodies. Now the costotransverse, the rib, costo rib, so costo is rib and transverse is transverse body, and basically they're talking about the joint here between the tubercle of the rib here, the tubercle of the rib with the transverse process of the vertebra. That's called the costotransverse. The sternocostal, between the sternum, one second. Between the sternocostal, between the sternum and the costal cartilage, right here, okay? Sternum and costal cartilage, this joint right here. Let me show you. This joint. The sternoclavicular, between the sternum and the clavicle, this joint. The costochondral, between the costos, between the rib and the costal cartilage. There, this joint. Interchondral. Interchondral. I'll show you what interchondral is. Interchondral is this interchondral between the costal cartilages, right here. This part. This is called interchondral. Then we have manubriosternal. Manubriosternal. This part where the sternal angle is present. The xyphosternal here between the xyphal process and the manubrium. This is for the joints of the thorax and the vertebral column. Joints of the shoulder gird. Easy. Shoulder gird joints. First, you have to tell them about the sternoclavicular joint. Then we're going to talk about the clavicular acromial joint. Then we're going to talk about of course, ligaments here are joints according to Cervical. So you have the acromioclavicular joint where the acromioclavicular ligament is present. And yeah, so, but let me just remove the veins and maybe I can mention. Okay, yeah, so this is it. Next, we're gonna discuss the joints of the three upper limbs. Shoulder joint, easy. When you talk about the shoulder joint, you have to mention when you're talking about the shoulder joint, you have to mention before we mention about the ligaments, we have to talk about the articular process, so the glenoid cavity of the scapula and the head of the humerus that form the ball and socket joint. Then we're going to talk about the ligaments. The ligaments are a lot of them actually, but mainly mention that there's a capsule that surrounds this joint and it is extending from the glenoid cavity around the head of the humerus, and it's called the labrum. And there's many joints here, many ligaments here. So we're going to be talking about mentioning the first of this joint right here. Come on, brother. Here, the Karako acromial ligament. Why is this important and why you have to mention it is because it prevents overflexion of the arm. So when you move this hand like that, it acts as a barrier for it to overextend. So that's the Karako acromial ligament. You have the glenohumeral ligament, and it's separated into superior glenohumeral ligament, the middle and the inferior. And then you have this ligament right here. This is the synovial membrane of synovial joint. Then we have this right here, the coracohumeral ligament. And I think these are all the ligaments that you have to know for this joint. And you have to maybe just go ahead further and discuss the burses. This is subdeltoid. This is the subacromial. This is the infraspinatus. That's, come on. The subcutaneous, okay, and maybe this one, subscapular. Okay, so this is just the joint for the shoulder joint. The elbow joint, we've mentioned this so much right now. The elbow joint, it's of course, the articulation is between the ulnar radius and the humerus. You have to mention how the ulna articulates with the trochlea, and the radius articulates with the capitulum, and then you have to mention the above the trochlea. There's the I think the what is it called, the choroid fossa or conoid fossa. Above the capitulum, there's the radial fossa. Then you have the olecranon process. Above it is the olecranon fossa, and then you can mention that it's a hinge joint, and you can mention the ligaments. Here, there's an articular capsule around the elbow, of course. And the ligaments present right here. First, we have the radial collateral ligament. Of the elbow joint, the posterior part, of course. Here, there's the anterior part, okay? And around the radial head, there's the annular ligament. He likes to always know this because the annular ligament fixes the radius to the ulna, okay? Then around the region of the ulna, there is, come on. You see how that's the annular ligament? It fixates the radius to the ulna. That's the ulnar collateral ligament, okay? Ulnar collateral ligament. This is the transverse part of the ulnar collateral ligament. And let me see if there's, yes, that's the come on. Anterior parts, transverse parts, and yeah, just know that there's this this ulnar collateral ligament and the capsule around it, and of course the radial collateral ligaments, anterior part and posterior part, with the annular ligament around the radius. Okay, that's the elbow joint. The wrist joint, here we have discussed this in my video previously. Mainly, okay, extensor retinaculum. Screw this one. But yes, you have radius articulating with the that's the scaphoid and the lunate, and articular disc here in the space that comes in. I don't know if you can see it. Hide. Hide. There, that's the articular process. Okay, that's articular disc between the ulna and the triquetrum. No, yes, triquetrum. Yes, triquetrum. Okay, and the ulna does not articulate directly with the carpal, unlike the radius. Okay, now we have so many ligaments in this region, and I've mentioned it in my previous video. So many of them, I just suggest you just go into the notes or revise my previous video for the ligaments. But for every joint, please know the ligaments. Joints of the hand, I've discussed this very precisely in my previous videos. Joints of the free lower limb, the hip joint, the knee joint, and the ankle joint. Okay. Yes, so for every joint, as I said, for the hip joint, for example, you have to know that the articulation surfaces is the head of the femur with the acetabulum, then the ligaments that are there, and when it forms a ball and socket. Then you have the ligaments there is the prebiofemoral, the ischiofemoral, and the iliofemoral. The knee joint, you have the articulation. You have to mention the patella articulating with the femur right here. Let me show you. Knee joint, you have to mention two things. You have to mention the articulation of the femur with the tibia and the articulation of the patella with the femur, and then the 5 external ligaments, and I think 4 internal ligaments. The 5 externals are the tibial collateral, fibular collateral, the patellar anterior, the oblique, and the arcuate popliteal. And inside you have the mainly the transverse ligaments. You have the I think the conoid ligament, and then you have the anterior cruciate and the posterior cruciate. That's for the ankle. That's for the knee. The ankle joint, you have to mention. We've discussed this so much, but you have to mention that the ankle joint is for the articulation between the tibia, fibula, and their lateral and medial lateral medial malleolar processes with the articular surfaces of the talus medially, superiorly, and laterally. And of course, the ligaments. Here we have the deltoid ligament on the side of the tibia that has made up of 4 parts or 3, I don't know. And here you have 3 ligaments in total. You have to know them, and you have to know what type of joint it is and how it moves. Pelvic gird, joints of pelvic gird, very, very, very easy. If you get this point, I think, I mean, most of the points are quite simple, but you just have to know the details. Here you have the iliosacral joints. Let me show you. So much connective tissue. I just need the specifics, but iliosacral joints, sacroiliac joints, sorry, between the sacrum and the ilium surfaces. Then we have the pubic symphysis here. Then we have the sacrococcygeal joint between the coccyx and the sacrum. These are joints of the pelvic gird. Anterior and basal view of the skull. We've done this so well in the skull video. I don't want to repeat it because it's so much lateral and posterior views of the skull. But just to quickly mention stuff, the anterior side and the basal side of the skull, you have to just mention the general bones that you see, the features that you've seen in there, like foramens, like notches, like just an articulate speech about what you see in those things. And you have to really put the skull in front of your head to actually know what you're actually speaking. Roof of the skull, this is one of the most annoying parts, but it's called the vault, and I think I've explained this really well in my skull video. But the vault was a very big confusion for people, because when Swirsky asked about it, he would like to know the borders of the skull, the borders of the roof of the skull. And for the borders of the roof of the skull, it's mainly a cut around the head, and the borders here, I think, according to my studies and according to what my previous students said, and I hope you can quote me on this if it's right, and I don't want to be quoted on if it's wrong, but the arches, the orbital arches, okay, goes through the external acoustic meatus and back to the occipital protuberance, and those 3 points, as you connect it, it's the way where we cut the vault and remove it, and that's, I think, the borders of the roof of the skull. The base of the skull, anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Just I'll go quickly over those because they're very, very, very easy, and I think they're fair points for all of you. Skull, I just want to remove it, isolate it, dissect it, look inside of it. Just quickly, we have the anterior cranial fossa. You got to mention the bones present to it. Here we see the frontal, the ethmoidal, the sphenoid, the borders, the front and lateral. We have the frontal bone, and then we have the sphenoid lesser wings with the chiasmata here, and the anterior clinoid processes. we can see some general features such as the frontal crest. We see also the what is it called? Crest? No. I forgot, but there's a part right here in the cribriform plate that anteriorly to it, there's the anterior ethmoidal foramina and posterior ethmoidal foramina, and foramen cecum is found in here as well. We can see the many jugums in these regions. Also, this the floor is formed by orbital plates that if we poke those regions here, we go into the orbital cavities, and if we poke this space right here, we go into the nasal cavity. These are the lesser rings here, and that's the posterior border of the anterior cranial fossa. Then the middle cranial fossa. So the anterior cranial fossa is the most shallowest, the middle cranial fossa is a little bit deeper, and we can see that the posterior border of the anterior cranial fossa is the anterior border of the middle cranial fossa. And here we have mainly the bones such as the sphenoid. We have the greater wings of the sphenoid bone. We have the petrous part of the temporal bone, and we have the squamous part of the temporal bone. And we have so many foramina such as the lacrum, the spinosum, the ovale, the rotundum, the superior orbital fissure. And we can see that there's an optical canals over here. And posterior border is made up of the superior border of the petrous part of the temporal bone plus the dorsum solae of the sella torsica. Of course, the sella torsica is found within the region of the middle cranial fossa, and you have to see that there's the infundibulum that contains the pituitary gland, house for the pituitary gland. And mentioning all those foramina is just quite important to know that you know really what you're talking about. Then the posterior cranial fossa, the anterior border is made up of the most superior part of the petrous temporal bone with the dorsum solae, which is this part. Then it comes behind it the clavus, and then the foramen magnum on either side, the hypoglossal canals, and then you see the occipital protuberance with the what is it called, the nuchal lines, the superior and the inferior, and the posterior cranial fossa. And posterior cranial fossa is the most deepest part of the cranium. Joints of the skull. This is a very good one. We've not discussed this very much, but joints of the skull, they're mainly sutures. Joints of the skull are mainly sutures. Let me just see if I can find the exact explanation for joints of the skull. There, I found them. Yeah, there we go. So the joints of the skull, they're sutures, they're fibrous joints. They're immovable joints, okay, also referred to as synarthroses. In the fetal skull, here it's a good idea to mention the fontanelle. So in the fetal skull, the sutures are wide, okay, and allow for slight movement during birth, but later they become rigid, okay. So here, the fontanelles is a very good way to mention the joints of the skull. So after saying fibrous or wherever, and then you can speak about the fontanelle. So during the infant period, infant's neurocranium consists of 5 separate bones. The frontal bone is twice, so it's not just one. In fetus, this is times 2, and prenatal is times 2, and 1 occipital bone. There's the fontanelles. There are the anterior fontanelle here in this region. The posterior fontanelle will be in this region, and you'll have the sphenoidal fontanelle in this region, and you'll have the mastoidal fontanelle in this region. You have to know that the anterior fontanelle is located between the frontal and the frontal, sagittal, and coronal sutures, and closed by month 12th to 18th. Closed by month 12th and 18th, so it's between this region. So month 12 and 18th. Okay, posterior fontanelle is located at the junction at the sagittal and the lambdoid in this region. Okay, and closed by 2nd and 3rd month. Okay, you have to memorize those times because he likes them. And the sphenoid fontanelle, irregular shape, located between frontal, parietal, sphenoidal, okay? Frontal, parietal, and sphenoidal, right here. Yeah, and it closed by 6th month, okay? And for the mastoid fontanelle located between the temporal, parietal, and occipital, temporal, parietal, occipital here, closed by 6th to 18th month, okay? Anytime between these, and you have to know these time frames very well. And finally, we didn't discuss this and never discussed it because I've never done a video about the mandible actually, which I have to do. The temporal mandibular joint, this part right here, temporal joint, mandibular, mandible. So temporal mandibular joint, okay? And here the shape is bicondylar, it's a synovial joint. Type is compound and complex, okay? The articulation is between the articular head, okay? Head of mandible, right here, and articular fossa, the mandibular fossa, and articular tubercle, right here, of the temporal bone. The articular surfaces are covered by a fibrocartilage. There is a fibrocartilage articular disc between those two bones. And 3 extra capsular ligaments. Lateral ligament prevents posterior dislocation of temporal mandibular joint, sphenomandibular ligament, and stylomandibular ligament. And I will show you, I hope I can show them the connective tissue. Yes. So, see, there. Styloid process. There. Sphenomandibular joint. This, look. This part. Isolate. Look. See? From the sphenoid bone to the inside of the mandible. Sphenomandibular joint. And stylomandibular joint right here. Or ligament, sorry. Fuck. Why am I saying ligament? Why am I saying joint? It's ligament, okay? Come on, bro. There. Stylomandibular ligament, okay? And finally, you have this ligament. The temporomandibular ligament, or the lateral ligament. Isolate. There. Okay? And you have the capsule, I think, or the articular disc. This one. Capsule. No. Isolate. There. Okay? And within this capsule, you have an articular disc, but I don't think you see it here. But there's an articular disc inside. Okay, that is all, people. That was just a quick run through your oral issues, and I'll just post it right now on the videos, and I'll make a video separately for the mandibular, the mandible itself. Okay. Thank you again for joining, and I hope you very good luck on your orals. I hope this helps you prepare for it, and I wish everybody within our first year passes their oral anatomy examinations, so that we can all celebrate together. And by the way, we're preparing for a huge meeting after your oral exam to celebrate together, so I hope you can study well, so that you can join us with a great pass. All right, people, good luck studying.